Good afternoon, everybody. I'm really glad to kick off our second session of Workforce Wednesdays. I'm really happy to introduce our host, our presenter today. This is our second session, but make sure you tune in for other sessions that are coming in the next month or so, and new topic every Wednesday. If you have any questions, you can put it into the chat on the. If you don't have chat open, you can go to the bottom of the Zoom and click on chat, and there you can chat with either other people on the call, the presenters, me, or Hannah, who is controlling our Zoom today. So thank you very much for being here. So I'm going to introduce Tami Turner. She is the employee health nurse here with Occupational Health at Tanner. She graduated with her BSN from the University of West Georgia, go Wolves, in 2002. She's been with Tanner Health System since 2001. She worked for 14 years on the pediatric unit at Tanner Medical Center, Carrollton, and moved into her role as employee health nurse in 2016. As the employee health nurse, she works closely with occupational health, infection prevention, human resources, and medical staff teams to ensure that all of our employees and medical staff meet all state and federal requirements for healthcare workers. This involves collaboration with many outside agencies like DPH, CDC, OSHA, and the Joint Commission, to name a few. She's responsible for the management of policies for exposures to bloodborne pathogens, respirator clearance, flu and tuberculosis testing, as well as she has been in charge of our employee COVID-19 vaccination program. She's married, has two sons who attend Carrollton City Schools. And so I'm very happy to introduce Tami Turner.
Thank you, Kelly. We're glad to be here and share some information with our Carroll County partners. So what we have here is just some information. So we're going to talk about vaccinations and how to keep your workforce safe and healthy now that it's back in the office. So of course, our COVID cases, hospitalizations, and unfortunately deaths are still on the rise. So us as...
Are you sharing your screen?
We thought we were.
I thought so. Hold on.
There you are. And if you'll make it in presentation, there you go.
All right, there we go. We got it now. Okay, so vaccinations and improving workplace safety. So again, our COVID cases in Carroll County, hospitalizations, and unfortunately deaths are still rising. So some things that we can do as employers and employees to kind of protect ourselves and each other. One of the main things is things that we call workplace or engineering controls. A main thing is wearing a mask, social distancing when you're able to. And a lot of times germs are spread in break rooms. We're all together, we're all hanging out. So those are one of the main places that germs can be spread. So making sure that we're doing those appropriate things in those break rooms, masking and social distancing are very, very important. Again, other things we can do, make sure you're washing your hands. I'm sure we've all heard this over and over since the pandemic has started, but it's the small things that really do help. Make sure to wash your hands often with either soap or water or hand sanitizer if soap and water is not available. Try not to touch your eyes, mouth, or nose with your hands. Of course, we found out that that's how some of these germs are passed. So the more you can not do that, the better it is. And then, of course, just keeping your work surfaces clean. Make sure you use a disinfectant to wipe down surfaces that are used a lot. Keyboards, mouse, phone, and then try not to use your coworker stuff. If you do, wipe it down before, wipe it down often, and don't share those supplies where germs are kind of passed easily from one person to another. And then a very, very important thing is if you are sick, please stay home and do not go to work. Even if you question it, you're not quite sure, it's better to know for sure that you're not sick, not contagious before you go to work. If you are sick and you need to be tested, all of our local urgent cares, you can come and get tested at for COVID. The CDC's policy right now for guidelines as far as staying home, if you're either positive or exposed, they have two different ones. One is quarantining, and that is if you are actually exposed to somebody with COVID-19. They suggest you quarantine at home for either 14 days, or if you're asymptomatic, 10 days, or again, 7 days if you have a negative COVID test after 5 days. I know that's kind of confusing, but the CDC has very good information on their website under their COVID link. You can find all this stuff that we're going to talk about today there. Then the CDC also talks about something called isolation. And isolation is what you do if you yourself either have symptoms of COVID or have tested positive. So if you yourself have symptoms of COVID, but you're not tested, you should stay at home or isolate for at least 10 days from the time your symptoms start, in addition to being fever-free for 24 hours. If you do get tested and are found to be positive, but are asymptomatic, you can return to work 10 days after your positive test. Again, a lot of confusing stuff, but CDC, like I said, their website is very, very good. You can print that out and hang it up, have it next to you if you need it. Again, making sure we're using our personal protective equipment. Face mask is very, very important. And when you're wearing your face mask, make sure that you wear it appropriately. Make sure your nose and your mouth are covered. I know sometimes we see a lot of people, my kids are the worst about this. They'll wear it just kind of right underneath their nose, not covering it up. And I always try and tell them it's not going to do a lot of good unless you wear it correctly. So making sure you wear it correctly. And then again, if you're in a large group setting, making sure you either socially distance or wear your masks. So this is a little video I'm going to get to see if I can play, just talking about how COVID vaccines work. Okay, so that was a quick little video. I think our society nowadays, we're all over social media, whether it's Facebook, TikTok, Instagram. We get a lot of our information from there. The main thing is making sure we're getting the correct and true information. And that video is just kind of a very easy way, kind of funny to look at how vaccines work. Before we get into talking about different vaccines, just wanted to give y'all some numbers. So for Georgia right now, we have 45% of our Georgia population that are fully vaccinated and 53% that are partially vaccinated. District 4, which includes 12 counties, including Carroll County, those vaccination rates for those 12 counties range anywhere from 24 to 56% for fully vaccinated and 28 to 62% for partially vaccinated. Carroll County itself is fully vaccinated 33% and partially vaccinated 38%. That is a number we would love to see go up. The higher our vaccination rate is, the more protection we have for ourselves, our friends, our family, and especially those who can't be vaccinated, whether because of an allergy to the vaccine, age, or other reasons. If we can get vaccinated to protect them and protect ourselves, that is just fantastic. All right, so some different types of vaccines. The first one we're going to talk about is an mRNA vaccine. And I know we've all heard a lot about that. That is a kind of new technology, but something that's been researched for years. And it's a way to make vaccines that does not use an inactive, weakened, or dead virus. Typically, that's how our flu vaccine is made. It's a dead virus that's injected and teaches our body what to do. With the mRNA vaccine, it actually teaches our body how to make a protein to trigger an immune response that will protect us from COVID, as you saw in that little video. Again, mRNA vaccines do not use a live virus, so a COVID vaccine cannot give you COVID. I know sometimes we do hear that with flu vaccines. Oh, I got the flu vaccine and I had the flu. Typically, what those symptoms are, it's not the flu, but it's what we call an immune response. It's something very completely normal that happens in our body, and it's actually a good sign showing us that our body is working and doing what it's supposed to make those antibodies to whatever was in the vaccine. And again, mRNA vaccines do not affect or interact with our DNA at all. That is not what they do. They just teach our body how to make that protein to fight off COVID whenever we're exposed to it. So, excuse me, there are two types of mRNA vaccines that are out right now. The first one we're going to talk about is the Moderna vaccine. It is 2 shots that are given 28 days apart. It does not contain preservative, eggs, or any metals. And the Moderna vaccine is recommended for those that are 18 and older. People that should not receive the Moderna vaccine is anybody that has had a severe reaction to any of the ingredients in the mRNA vaccine, or if you've had a severe allergic reaction to any other ingredients. The ingredient list, I believe, is on the CDC website. You can look on there. If you do have several allergies to different things, definitely speak with your doctor, find out which vaccine is the best for you to take. After the mRNA Moderna vaccine, possible side effects can include pain at your injection site, some redness, small amount of swelling. You can also have full body chills, muscle aches, some fatigue, and also run a low-grade fever. All that is very, very normal. Like I said, it's an expected immune response after you have a vaccine. If you do get a vaccine and have a reaction outside of those things, please contact your doctor. You can also use, there's an app called VSafe, I believe is what it is, and you can report any vaccine side effects other than expected side effects. You can report it through there. Side effects with Moderna vaccines, typically, if you're going to have it, it's going to happen within 2 to 3 days, and it typically only lasts for 48 to 72 hours. Another one that's not on here that we've had a little bit of is headache. Very, very normal. We've seen that a lot with the Moderna vaccine, and typically goes away within 1 to 2 days after your first or second vaccine. People that have had COVID in the past are typically going to have a higher immune response. So you may see more of these symptoms. They may be a little bit worse than somebody who has not had COVID previously. Our second mRNA vaccine we're going to talk about is Pfizer. Pfizer is a 2-dose vaccine also, and it is given 21 days apart. Same as Moderna, it does not contain eggs, preservative, latex, or metals. Pfizer is actually recommended for people 12 years of age and older, and we've had a really good success with some of our school-age children being vaccinated, and it's amazing some of them to see. They're very excited about getting it, coming in, getting it done. I think we saw one of our doctor's children on the Tanner site the other day was more excited about getting his treat afterwards, and that's exactly how kids are. So whatever we can do to kind of make it fun for them and let them know that they're able to protect themselves, that's just great. Again, do not get the Pfizer vaccine if you've had any kind of severe allergic reaction to any of the ingredients or other severe allergic reactions. Again, check with your provider and make sure you're doing the best thing for yourself. With Pfizer, side effects are very, very similar. Pain at your site, some swelling and redness, possible nausea, some fever, fatigue, muscle aches. All that is very, very common. Again, an expected immune response. With both Pfizer and Moderna, any side effects that you experience, Tylenol and Motrin are perfectly fine and acceptable to take for any of those, and also making sure you're drinking plenty of water and getting as much rest as you possibly can for those couple days after you receive the vaccine. All right, and another vaccine that is out now is Johnson & Johnson, or Janssen is what you may see it referred to sometimes. It is actually a viral vector vaccine, and it is similar to the flu vaccine, but a little bit different. Where a flu vaccine has a dead virus, the Johnson & Johnson is a modified version of the virus. So again, no eggs, preservative, latex, or metals, and it is only 1 shot, and it is also recommended for those age 18 and older. Again, any severe allergic reactions or any reactions to any components of the vaccine, you should not take it. Same possible side effects, arm pain, redness, fever, tiredness, muscle aches, all that is completely normal and typically go away within 2 to 3 days. You may have heard with the Johnson & Johnson or Janssen vaccine, there is sometimes a risk of blood clots and low platelets after receiving the vaccine. That is a higher risk in women that are younger than 50 years old. So again, make sure that you talk with your doctor to make sure that you're making the appropriate choice on your vaccine for yourself. All right, so vaccine effectiveness. So this is some information that we got from our infection prevention team, and this was as of, I believe, Monday the 20th. And it's showing that with our Moderna, can we move this screen over a little bit?
What screen?
This, move that over there so I can see our data. Oh, wait, yeah. Hold on. Let me get to my information I have right here. I'm sorry. Okay, so in adults without immunocompromisation, the effectiveness for March 11th to August 15th for the Moderna vaccine was 93%, Pfizer was 88%, and the Janssen or Johnson & Johnson vaccine was 71%. So these are all very, very high. They're very good rates of protection, and it does differ from person to person, just depending on how our bodies react with things, but all of them provide very good protection against COVID-19. Again, another important aspect is to remember that if you get a vaccine that's a 2-dose series, to make sure you get your second vaccine. Typically, after your first vaccine, you only have a very small percentage of protection, and then you get your full protection about 2 weeks after your second vaccine. So making sure you get that second one is very, very important. CDC does not recommend one vaccine over another. And again, just make sure you talk with your healthcare provider. If you're at a vaccine event, you can talk with any of our nurses there. CDC has very good information, and you can look at any of those places to kind of get some information on which vaccine would be the best for you. So again, just a quick overview of our different vaccines that we're offering now. We have the Pfizer, which is approved for people 12 and older. 2 shots given 21 days apart, and again, fully vaccinated 2 weeks after your second shot. Moderna, for people 18 and older, 2 shots given 28 days apart, and again, protected fully after 2 weeks after your second shot. And Johnson & Johnson or Janssen, people 18 years and older, only 1 shot, and you're protected 2 weeks after that shot as well. All right, so these are some frequently asked questions that we've gotten from some of our employees, and just kind of since we've been doing our vaccine since December, things that we kind of noticed that people typically want to ask about. How long do I need to wait after I get another vaccine? So the CDC has recently changed in the last 6 months, and you can actually get COVID and other vaccines at the same time. We recently started doing our employee flu clinics this week, and we had several employees that came in and they got their first or second COVID and their flu vaccine at the same time. Have not spoken to any of them since it was just Monday, but typically they should do just fine. Again, if you take any other vaccines at the same time, make sure you know what you're taking. If you have any side effects, make sure you let your doctor or provider know. If I've already had COVID-19 and recovered, do I still need to get vaccinated? Yes. Your immunity wanes, and we're not quite sure how long that immunity lasts after having COVID. So making sure that you get protected with the vaccine is another way just to make sure that you're fully covered. Can I get vaccinated while I'm currently sick? If you have symptoms of COVID-19, you should wait to be vaccinated until you've recovered from your illness, meet your criteria for discontinuing either your isolation or quarantine, and have no symptoms. Any vaccine, COVID, flu, childhood vaccines, we want to make sure that you're healthy when you get your vaccine. So that's meaning that you're not feeling sick that day, you're not running a fever. All those things are important to make sure are not going on before you get your vaccine. This applies for both your first and your second dose. You want to make sure you're feeling well before you come in. If I'm fully vaccinated, do I need to wear a mask? So this is something we hear a lot, and if our numbers are going down, we'd say, yes, you go out there and do your thing. But since our numbers are still going up, if you're fully vaccinated in outdoor settings, probably not. But if you are in an indoor setting, and especially in community settings where our numbers are still high, then yes, wearing a mask is the best thing right now to make sure that we protect everybody. Like it says, wear a mask when you're around others who are not fully vaccinated. We don't always know that. And, we're not going to ask everybody. So just making sure that you go ahead and just do that anyway. And then like, again, it says indoors in a public area or area of high transmission. So again, just making sure that we're all doing everything we can to protect ourselves and our family members and coworkers. If I'm pregnant, can I get the COVID-19 vaccine? Yes. COVID-19 recommended for all people 12 and older, Pfizer, and then 18 and older, Moderna and Janssen, including people who are pregnant, breastfeeding, trying to get pregnant, or maybe become pregnant in the future. We've had several of our staff members that have been pregnant, gotten the vaccine, doing wonderfully, and we've unfortunately seen a lot of people that are pregnant that have been sick, and it's so much harder on your body. You're already, going through a lot being pregnant. So if you can keep yourself from being sick while you're pregnant, that's just going to protect you even more. If I missed my second dose, do I need to restart the series? So the CDC does recommend getting those doses as close to your interval as possible, either 21 days for Pfizer or 28 for Moderna. But if you do have some extenuating circumstances that put you outside that window, that is okay. It says 6 weeks or 42 days is kind of the window that they like, but there is no need to restart the series. We've had several employees that have unfortunately gotten COVID after their first dose and had to wait up to 90 days. They've come in and got their second dose. So again, like we said earlier, making sure you get that second dose so you keep that immunity high is very, very important. This is just a list of some of our references, some things that we use. Our CDC website is very, very good for information. If you are looking to find a place to get a COVID vaccine, vaccinefinder.org, I have found, is fantastic. It lets you search by zip code and by specific vaccine. So if you're trying to help a family member, even out of state, find a vaccine, you put the vaccine, you put your vaccine type in, and then you put your radius and your zip code in, and it will find all the local pharmacies or places around you where that certain vaccine is being offered. And it even also offers a link to that location with a telephone number and an address, so you can reach out and see if they're taking walk-ins or appointments. And then, of course, Tanner.org, Take My Shot. Every time a new vaccine clinic is posted, that will be available for signups and everything. So we have very many community events trying to get everybody that we can get in and get vaccinated. And that is always a very good resource as well. All right, and I'm going to turn it over to Christy Dunson now. She has some very important information from OSHA and just, again, keeping our workplace safe and healthy. So here's Christy.
Excuse us while we transition here. I'm Christy Dunson. I'm the director for Occupational Health Services at Tanner. And I did just want to end the presentation to make sure everybody is aware of OSHA's new publication regarding COVID and keeping your workers safe. So in January, President Biden did issue an executive order declaring that health and safety of workers would be a national priority, and then directed OSHA to take that action on. The rule was published June 21st of 2021 and was also reviewed in September. And as per the website, the standard will remain in effect until further notice. The purpose was that they didn't feel like current OSHA standards met guidelines to keep employees safe during COVID. Overall, the plan applies to healthcare services or healthcare support services, but when reading through the people that had signed up for this webinar, many of you are affected by it and may not know that you're affected by it. It does have a provision for embedded healthcare services in manufacturing and EMS. So if you have a clinic inside the school or inside your plant, you may be a city or a county entity, but you do have EMS. So basically anybody with a license is covered under this ruling. If you are exempt from this ruling, the OSHA mandate clearly states that you should follow the executive order from your state or local health department and the CDC. So I won't, because the plan is very detailed and applies mainly to healthcare workers, I won't go into a lot of detail. There's a link at the end of this presentation that talks about the plan. There's fact sheets, a sample policy. There's a guide or a flow chart that says, is your workplace covered by the standard? and you can follow it to see if you are. But I will touch base on just a few of the things that are outlined. So the employer should have a written COVID-19 plan that is accessible to all employees. Screening and management is a big part of it. So points of entry, patients or employees should be screened. So for an embedded plant in a manufacturer or a school nurse environment, this would only apply to your healthcare area. It would not apply to the entire facility. And OSHA does clearly make that distinction in the standard. It talks about standard and transmission-based precautions. You must give your employees time off without punishment for vaccine. There's a training component to it, anti-retaliation for those who contract COVID. There's a PPE component, of course, like Tami mentioned, physical distancing and physical barriers 6 feet apart, making sure you have the glass or whatever is within normal standards to keep your employees safe. Cleaning and disinfection, health screening and medical management. There is a very detailed part about how employees are supposed to be screened during their shifts, about the time frame to report illnesses, those types of things. Requirements must be implemented at no cost to the employee. Record keeping and then reporting any OSHA related fatalities within a certain amount of time. I think it's 8 hours to OSHA. However, I do want to just point out that OSHA is very clear about the contracting of COVID at work, and it has to be beyond reasonable doubt that the virus was contracted during work environment, meaning you haven't been to the grocery store or the ball field or anywhere else that you could have contracted COVID. So that's very hard, and the burden of proof lies on the employee before it becomes an OSHA recordable. These are mine and Tami's contacts. And then the link at the bottom is where you would go to get any information, more information that you'd probably want to know about the new OSHA standard. And at this time, we'll look to see if we have any questions.
Christy, I have a question about shared offices. I know a lot of people are headed back to the office in the fall, and can you give any hints on how maybe employers can look at how do we facilitate cleanliness and shared offices and just make things safe for our employees?
Yes. So the OSHA standard, again, really only applies to healthcare environments, but it does give some great guidance for all employers. So it does talk about the requirements for cleaning and disinfecting, and it even gives the percentage of alcohol base that it should use. And it also talks about barriers. So I just think anything you can do to create a barrier, if it's just a screen or a cubicle or anything like that. But I do recommend that you go to this OSHA website. They have a lot of good information there for non-healthcare environments.
Does anyone on the call have questions for them? Oh, someone has a question. When will the COVID vaccine booster be approved?
That is such a great question.
Great question.
It went before the FDA last week, and there were some exceptions made, like maybe some age requirements, maybe healthcare. So it was not approved initially to be available to everybody who is available for the first and second shot or eligible for the first and second shot. The committee meets again today and tomorrow, so look for information forthcoming at tanner.org.
And in regards to that, for manufacturing, has any guidance been pushed out there about the burden to employers on testing if they don't institute a vaccine mandate? Have you seen anything on that?
I haven't for manufacturers. I do know that in the OSHA plan, though, that testing cannot be at any cost to the employee. And typically when OSHA posts something, it's just a good rule of thumb So I, again, highly recommend that you go and look at this fact sheet that gives you very detailed requirements for that. But I haven't personally seen anything specific to manufacturing. But typically when OSHA does something for one industry, it will trickle down to other industries.
And have you heard of any local employers that are doing on-site testing, and how are they doing that?
It is a hodgepodge. So at Urgent Care, Occupational Health, we're doing a lot of it. Some of our major employers are hiring third parties to come in and do massive screenings. Some people have a return to work policy, or so it's very, very different. But I will say I don't know of any employer that doesn't have some type of plan in place.
Great. Do we have any other questions from the call? Well, if we don't have any more questions, I just wanted to tell you about the upcoming next Workplace Wednesday is on the 29th, and it's going to feature Tanya Folks, who is the Outreach Operations Manager for Tanner, as well as Emily Talley, who is our Vice President for Human Resources, and they are going to be talking about how you can bring workplace wellness to your organization and how it works. They're going to have some great case studies and some great information for you. You register for it and for any of our upcoming sessions on tanner.org, just like you did for this one. Let me just make sure we don't have any more questions. We don't. So thank you very much, Tami and Christy, for bringing this information to us. Thank you very much for your time. And then we have a comment from Jacqueline, who is a big supporter of Tanner and one of our friends. She said, thank you so much. This has been great. So thank you, everyone, and feel free to reach out if you have any questions. Thank you very much and have a great rest of your day.
Thank you.